You know that healthcare is one of the fastest growing and highest paying industries out there. And I'm here to help you learn about the best of the best. So today, we're talking about the fastest booming healthcare jobs. Hey everybody, my name is Hisham Khan and welcome to Income Over Outcome, your go-to source for all the college and career resources that you need. The first job that comes to most people's minds when they hear about healthcare are just regular old doctors. But becoming a doctor is really competitive, costly, and stressful. For most people, it's not even worth it. But there's so many other underrated options in healthcare that have way more demand. The top jobs I'm about to talk about pay well over $120,000 and are growing by over 40%. So be sure to watch carefully. Let me know if you have any questions and comment which one of these jobs are most interesting to you. If you saw my video on healthcare jobs of the future, then you know the healthcare industry is moving towards more personalized one-on-one care to patients. With that trend, there's a lot of new job opportunities coming up, and one of the highest growth ones are home health aides. The people who need home health aides are usually older people or people with disabilities who are still able to do most things by themselves. They aren't sick enough to be admitted to a hospital, racking up a bill that costs over tens of thousands of dollars, and they don't need to be cared for all the time, so they don't have to be put into a super expensive nursing home. But they still might need help with some normal day-to-day things, like moving around the house, cleaning, or even eating food. So home health aides travel to these patients' homes to give them any help that they might need. They can spend anywhere from a few hours to a whole day with their patients, doing things like helping give them medicine and even helping them get dressed. As I said earlier, the trend towards more personalized care is really helping the home health industry boom. People love the independence of living at home while getting all the personalized help that they need. But another huge reason demand is only going to increase is because the way our population is changing. The number of people aged 65 and older has absolutely skyrocketed over the last decade, and it's only going to get higher as our parents get older. That's the exact population that's going to need more help on a day-to-day basis, which is why it's expected over 1 million new home health aide jobs are going to be added to the market over the next decade. That's a whopping 33% growth rate. Keep in mind the average growth rate across all jobs is just 7 to 8%. So 33% means there's a ton of opportunity within the field. The only downside is that the pay isn't all that high, coming in just under $30,000. But you also don't need a college degree, can do the job on a part-time basis, and have a huge impact on people's lives. So it's a great option for a lot of people, especially if you're someone who's still in school and needs a way to make extra cash. Now it makes sense that because the population is aging so quickly, demand for healthcare professionals is going up. But you'll notice that a lot of the careers on this list are for people who help other medical professionals do their job. That's because having assistants helps doctors, nurses, and other professionals take care of a bunch of patients at the same time while making sure each patient is getting personalized care and the treatment that they need. In other words, the reason there's so much demand for medical assistant jobs is so that we can meet the demand for the population that we have. So that brings me to occupational therapy assistants. This is by far one of the fastest growing careers out there with an expected growth rate of 34%. Now, occupational therapists come up with treatment plans made up of exercises to help people who have trouble moving around because they're injured, sick, or disabled. They can do things like help people improve hand-eye coordination and even develop fine motor skills to help people do things like write. Usually, an occupational therapist is the person who examines a patient and creates the best treatment plan based on what they find. And then the occupational therapy assistant is the person who actually helps the patient carry out that treatment plan and closely monitor the patient's progress. They would work directly with the patient and help them figure out how to do the exercises that are assigned by their occupational therapist. The best part is you only need an associate's degree, meaning it takes just 2 years to get trained to be an OTA. On the other hand, to become a full-fledged occupational therapist, you need a master's degree. That means you have to spend another 2 to 3 years after college in a master's program. Not only is that a ton of time, but also way more money. So this can be a great path for somebody who's looking to get a decent paying job as quickly as possible. The median salary comes in at just under $62,000. That's more than the average American household income, which is really good for someone without a bachelor's degree. Staying in line with healthcare professionals who help assist someone else, one of the fastest growing healthcare careers are dental hygienists. Now, I'd hope that you've seen a dental hygienist at some point in your life. If you haven't, then you might want to rethink your life choices and get on that. That's because a dental hygienist is a person who actually cleans your teeth and does most of the things in your mouth when you go to see the dentist. In most cases, the dentist only looks at your teeth to figure out if there's anything wrong, and that doesn't take too long. Then they tell the dental hygienist what they need them to do. Demand is growing by 11%, which might not seem like much compared to the other jobs I just spoke about, but remember that the average growth across jobs is just 8%, so 11% is still pretty impressive. The pay is also great, with the average salary coming in at around $80,000, but in some places like New York, you can earn much more, with some dental hygienists racking in over $100,000. And if you watch my videos, you know I give you a ton of info on jobs that can earn you over 6 figures. But I still know a lot of you aren't subscribed, so make sure you hit that subscribe button so you don't miss my videos with all the information. Now, it's true that a dental hygienist earns much less than what a full-fledged dentist earns, but dental hygienists require way less schooling than actual dentists. In most places, you can become a dental hygienist with just a 2-year degree, although some of them choose to get a bachelor's. But to become a dentist, you have to go to dental school, which is a whole 4 years in addition to your undergrad. And it's insanely expensive. The average dentist who graduates from dental school has over $300,000 in debt. So for people who want to make a decent living and are passionate about dentistry but don't want to go into all of that debt, being a dental hygienist makes complete sense. So you might have found the jobs I just spoke about pretty cool, but buckle up because I'm just getting warmed up. All the jobs I'm about to talk about have the potential to pay over $100,000 and have insanely high growth. One of the most lucrative careers that's going to boom in the future is physical therapy. Demand is expected to grow by 21%, and it offers a relatively comfortable lifestyle that's flexible. Unlike a ton of other healthcare careers where you're working ridiculous hours and dealing with super stressful situations. That's because most physical therapists work during normal work hours and can select their own schedules, choosing exactly when or when they don't want to see patients. Now, the job is exactly what it sounds like: therapy, but for the physical body. Let's say somebody gets into a really bad accident where they have a cast on their legs for months. They can't exactly get up and start running the exact same day that the cast is off. They have to gradually learn how to use their leg again. So physical therapists look at the exact problems that their patients have and then come up with the proper exercises to help them get to 100%. In general, as a physical therapist, you'll come up with treatment plans to help patients who need help moving their bodies or manage their pain. But it is the most complicated job I've spoke about so far. You can't just become a physical therapist without a bachelor's degree like some of the other jobs. You have to go to PT school, which is another 3 to 4 years after you get your bachelor's. After PT school, you have to pass a test called the National Physical Therapy Exam to get your license to practice. And then on top of that, most states require you to get a state license. So it definitely won't be an easy path, but it's well worth it for a job that's in such high demand, flexible, and has a median salary coming in at $96,000. Now, one of the highest paying careers with insane growth are nurse practitioners. Demand is growing by a whopping 45%, making this not only one of the fastest growing healthcare careers, but one of the fastest growing careers in general. The reason for all of that demand is mainly because of the aging population I spoke about earlier. More people than ever before are gonna need to be cared for in hospitals. But part of the reason is also because it's been difficult to find enough doctors. A lot of people have been avoiding becoming doctors because of all the stress and financial investment that it takes. So nurse practitioners are supposed to help fill that gap. In fact, in 22 states, NPs have full medical authority, which basically means they can do anything doctors can do, from prescribing medicine to ordering tests and diagnosing patients, all without physician oversight. In other states, NPs need to have a doctor sign off on everything they do, but more people are willing to become NPs because it's quicker and cheaper. The first step is to become a nurse by going through a normal nursing program, and then there's more advanced training that you need to get through a master's in nursing. After your master's, you have to take a test to get nationally certified and then get a license to practice in your state. And while that's a lot, you save on 4 years of med school and more years if you do a residency. You would be able to avoid the $200,000 in debt that most doctors face when they graduate med school, while still making a great income, with the average NP earning $121,000. They can earn even more if they specialize in something. This next career is very similar to NPs, but some of you might be more interested in it. With a growth rate of 31%, we have physician assistants, otherwise known as PAs. While many of the things NPs and PAs can do overlap, the main difference is with their training. PAs train on the medical model, which is the model that doctors use. That means they focus on testing, diagnosing, and treating patients. While NPs train on the nursing model, which means they focus on the impact of treatment on patients so they can personalize care. But pay is really similar to NPs, with the average PA earning around $122,000. So let me know which one of these jobs you found most interesting, and be sure to check out incomeoveroutcome.com. Also, don't forget to hit that like button and subscribe if you haven't already. I'll see you next time, but until then, peace.